In the early 1900s, tuberculosis killed 1 in 7 people across Europe and North America. The accepted response was sanatoriums, isolated facilities where patients rested in open air, far from city centers. Rest, sunlight, distance. But architects across dozens of cities were designing something different. Buildings with ceiling heights of 14 to 16 feet. Window-to-floor ratios that exceeded residential needs by 40%. Ventilation systems with dedicated intake and exhaust channels built into walls. Structures that wouldn't become medical standard until the 1950s. The pattern appeared in train stations, civic halls, administrative buildings, hotels. Boston, Manchester, Budapest, Melbourne. Cities that had never coordinated their building codes were implementing nearly identical environmental health principles, decades before germ theory became widely institutionalized. The official record attributes this to industrial prosperity and aesthetic preference. The buildings remain. Before we continue, a note on methodology. This documentary examines architectural and urban planning patterns from the late 1800s through early 1900s. We're working with public records, building specifications, and historical accounts. Some of what we'll explore has been reinterpreted through contemporary alternative historical frameworks. Our purpose is to present observable patterns and multiple perspectives, not to advocate for any single explanation. What matters is what's verifiable, documentable, and present in the structures themselves. The conventional narrative is straightforward. The Victorian era brought wealth. Wealthy societies built grandly. High ceilings conveyed status. Large windows displayed expensive glass. Ornate ventilation was decorative luxury. This explanation accounts for cathedrals and opera houses. It accounts less well for warehouses. In 1889, a grain storage facility was constructed in Minneapolis with specifications typically reserved for hospitals. 22-foot ceilings. Cross-ventilation arrays. Interior air circulation designed to prevent moisture accumulation and maintain consistent temperature. Features that wouldn't appear in commercial food storage standards for another 40 years. The building still stands on Washington Avenue. No commemorative plaque explains why a grain warehouse received hospital-grade environmental systems. The same year, civic water infrastructure projects began in Philadelphia that included redundant purification stages. The system used settlement tanks, sand filtration, and chemical treatment, 3 stages. Contemporary standards called for 1. The additional stages were described in engineering records as excessive but prudent. Excessive against what baseline? Prudent against what threat? In Manchester, the 1895 expansion of the municipal library included dedicated fresh air intake systems that drew from rooftop vents, passed through heated chambers, and distributed through floor-level grills. The system was automatic. It required no human operation. The building's environmental conditions were self-regulating within a 2-degree temperature range. This was 11 years before the first modern HVAC system was patented. The architect's notes describe the system as standard restoration of proper air quality measures. Restoration. Not innovation. Restoration. These weren't isolated cases. Between 1885 and 1910, more than 200 civic buildings across North America and Europe were constructed or renovated with environmental health features that preceded their medical justification. High ceilings with specific cubic air volume per occupant. Windows positioned for cross-flow ventilation. Thermal mass systems that stabilized interior temperature. Materials selected for non-porosity and ease of sanitation. The timing raises questions about origin. In Chicago, the 1893 World's Columbian Exposition showcased what was called the White City, temporary structures built with uniform design principles. Broad boulevards. Reflecting pools positioned for humidity control. Building orientations that maximized natural light and airflow. The layout resembled therapeutic hospital campus design. It was dismantled after 6 months, but the design principles migrated. Within 3 years, Chicago's public school construction standards adopted the same ceiling heights, window ratios, and ventilation specifications. Not as aesthetic choice as health policy. The city's Board of Education minutes reference re-establishment of healthy atmospheric conditions in learning environments. Re-establishment. Again that word. As if these standards had existed before. The pattern extended beyond buildings. In 1902, New York implemented water fluoridation and sewage separation systems simultaneously. Both projects were described in municipal records as restoration of prior sanitation standards to modern capacity. Prior standards from when? The city's infrastructure had been rebuilt after the 1835 fire. That reconstruction used older street layouts and supposedly incorporated traditional design principles for public health. But no earlier American city infrastructure existed to copy. The colonies had been rural. There were no prior urban American templates. So where did the templates come from? In London, the 1858 Great Stink prompted sewer system redesign. The solution, Joseph Bazalgette's sewer network, is celebrated as Victorian innovation. What's documented less frequently is that Bazalgette's design incorporated Roman engineering principles that hadn't been used in Britain for 1400 years. Gravity-fed systems, redundant outflow channels, material selection for durability over centuries. The design worked immediately. No prototyping phase. No iterative improvement. First implementation, full function. Across the Atlantic, the same decade saw American cities implementing grid-pattern streets with specific width-to-building height ratios that optimized air circulation and sunlight exposure. The ratios were consistent. Streets at least 1.5 times the width of adjacent building heights. This wasn't organic growth. It was planned implementation of calculated proportions. The calculations matched city designs from Central Asian urban planning, cities that American engineers in the 1860s had never visited. By 1905, the pattern had become systematic. Building codes in Boston, Philadelphia, Toronto, and San Francisco included nearly identical specifications for cubic feet of air per occupant in public spaces, window area as percentage of floor area, minimum ceiling heights in commercial versus residential structures, ventilation rates for different building uses, material requirements for walls, floors, and fixtures. The codes read like they were copied from a common source document. No such document appears in archives. The health outcomes were measurable. Cities that adopted these building standards saw tuberculosis mortality rates decline 20 to 30% faster than cities that didn't, even before antibiotic treatment existed. The buildings themselves functioned as passive medical intervention. The architecture was performing epidemiology, and it was being implemented as restoration of forgotten standards, not development of new ones. This raises a structural question about historical knowledge transfer. If these design principles were restorations, what was being restored? If they were adaptations, what were they adapted from? The evidence trail leads toward something documented in administrative records but absent from popular historical narrative, a set of health and infrastructure practices that appeared simultaneously across multiple continents in the late 1800s, treated by contemporary engineers and planners as recovery of prior knowledge rather than innovation. The question isn't whether the buildings exist. They exist. The question is what prior system they were being made consistent with. In 1825, the Erie Canal opened, 363 miles connecting the Hudson River to Lake Erie. The canal was celebrated as commercial triumph. What received less attention were the specifications. The canal was built 40 feet wide and 4 feet deep. Within 15 years, it was operating beyond capacity and required expansion. But the original construction had included foundation work and earthwork designed for a canal twice that width and depth. The excess capacity was built into the foundation from the beginning. Engineering records describe this as accommodation for future expansion based on historical navigation standards. The records don't specify which historical navigation they reference. No comparable American canal system existed previously. The foundation work cost nearly double the canal itself. The same pattern appeared in railroad construction. Between 1850 and 1890, American railroad companies laid track using gauge widths and load specifications that exceeded contemporary locomotive capacity by substantial margins. The tracks could handle weight and speeds that wouldn't be achieved until diesel engines appeared in the 1930s. The Transcontinental Railroad, completed in 1869, used rail specifications that matched European heavy freight standards. Standards that themselves referenced traditional trade route requirements without identifying which routes. The track gauge measured 4 feet 5 inches. This precise measurement appeared in railroad construction across 4 continents simultaneously, as if copied from a common engineering standard. The measurement traces back to Roman chariot axle widths, but the connection was never formally documented in railroad engineering manuals. It simply appeared as default specification. Britain's railway expansion between 1840 and 1870 showed the same anticipatory design. Station platforms were built with width and length specifications for trains that didn't yet exist. The platforms could accommodate 12-car trains. Contemporary trains ran 4 to 6 cars. Platform construction records describe the dimensions as standard restoration specifications. There's that word again. Standard. In the American Midwest, grain elevators constructed between 1880 and 1910 were built with vertical storage capacity that exceeded regional wheat production by factors of 3 to 5. The elevators included structural reinforcement, foundation depth, and material thickness designed for storage volumes that wouldn't be reached until mechanized farming in the 1940s. The Chicago Board of Trade building, completed in 1885, included climate-controlled storage chambers with specifications that wouldn't become agricultural standard until the 1950s. Temperature regulation within 2-degree variance. Humidity control systems. Air circulation preventing mold and pest infiltration. The technology was described as implementation of proper storage methods. Not new methods, proper methods. Electrical grid installation followed similar patterns. When American cities began electrification in the 1880s and 1890s, the conduit systems, transformer stations, and distribution networks were built with capacity margins of 200 to 400% above initial demand. New York's first electrical grid, activated in 1882, included underground conduit with capacity for cable loads that wouldn't be needed until the 1920s. The excess capacity required additional construction cost and extended timelines. The project budget lists this as infrastructure restoration to accommodate full implementation. Full implementation of what? The electrical systems weren't prototypes. They functioned at scale immediately. No experimental phase. No gradual adoption. Cities transitioned from gas lighting to electricity with systematic coordination, street by street, district by district, following implementation schedules that read like they were executing an existing plan rather than developing a new one. London's electrification showed identical patterns. The grid was built with redundant pathways, backup systems, and load distribution that anticipated failure points before they occurred. The system design included principles that wouldn't be formalized in electrical engineering until the 1930s. It worked correctly from activation. Water infrastructure followed the same anticipatory model. Boston's Metropolitan Water System, completed in 1895, was built with reservoir capacity and aqueduct volume that exceeded the city's needs for 30 years. The system included multiple redundant pathways, pressure regulation stations, and purification facilities designed for population levels Boston wouldn't reach until after World War II. The engineering plans describe this as re-establishment of proper municipal water standards with modern materials. Re-establishment implies something existed before. Boston's previous water system had been basic wells and local springs. There was nothing to re-establish. Yet the language persists across dozens of municipal projects. Re-establishment, restoration, proper standards, traditional methods. Administrative language reveals pattern. Between 1870 and 1920, municipal planning documents across the United States and Britain used remarkably similar vocabulary. Restoration of traditional civic design principles. Re-establishment of proper sanitation infrastructure. Implementation of historical urban planning standards. Accommodation of standard public health requirements. The language implies these weren't innovations. They were recoveries. Building height regulations appeared simultaneously in multiple cities. In 1893, Chicago established maximum building heights based on street width, a ratio-based system rather than absolute limits. The ratios were specific. Buildings could not exceed 1.5 times the width of adjacent streets. The same ratio appeared in Boston's 1904 building code, then Philadelphia's 1908 code, then Toronto's 1912 code. No documented coordination between these cities exists. No planning conferences. No published guidelines. Yet the same mathematical ratio appears as if it were standard knowledge. Street width itself followed patterns. American cities rebuilt or expanded between 1870 and 1920 used street widths that clustered around specific measurements. 66 feet for major avenues, 33 feet for secondary streets, 5 feet for residential lanes. These measurements are multiples of 5 feet. The same base unit appears in British urban planning from the same period, and in Australian city layouts, and in Canadian civic design. A common measurement standard was being implemented across multiple nations with no documented source. Public building specifications showed similar consistency. Libraries, courthouses, municipal halls, and post offices constructed between 1880 and 1920 shared architectural features beyond aesthetic style. Ceiling heights of 14 to 16 feet in public areas. Window area comprising 25 to 30% of wall surface. Floor-to-window sill heights of 30 to 36 inches. Door heights of 9 to 10 feet. Corridor widths of 8 to 10 feet. These weren't aesthetic choices. They were specifications that appeared in building codes and construction contracts with minimal variation across thousands of miles. The specifications optimized for airflow, natural light, and occupant density, optimization that preceded the public health research justifying those specifications. The buildings were built correctly before anyone officially understood why those dimensions were correct. Whether this reflects inheritance of prior knowledge or parallel development of best practices remains ambiguous. But the scale of consistency and the anticipatory nature of the infrastructure creates pressure on conventional explanations. These weren't experiments that succeeded. They were implementations of established standards that worked immediately across multiple domains: transportation, water, electricity, architecture, urban planning. The coordination wasn't documented, but the consistency was absolute. And it was all described in administrative language as restoration. The term Tartaria appears in European maps from the 15th through 19th centuries. It designated a vast territory across Central Asia, a geographic label, not a political entity. The name derived from Tartar tribes and was used by European cartographers to describe regions they had incomplete information about. By the mid-1800s, the term had largely disappeared from official maps as geographic knowledge became more precise and political boundaries were redrawn. Russia expanded eastward. The Qing dynasty solidified control. European powers mapped territories with greater specificity. Tartaria as a geographic designation faded from administrative use. In the early 2000s, the term was revived in alternative historical frameworks. Modern interpretations propose that Tartaria represented not just a geographic area but an advanced civilization whose architectural, infrastructural, and organizational knowledge was integrated into 19th century reconstruction efforts following a global catastrophic event. This reinterpretation attempts to account for the patterns we've examined: the simultaneous implementation of advanced infrastructure, the anticipatory design, the administrative language of restoration. Three interpretive models exist for the evidence. The first model accepts conventional historical narrative. The infrastructure patterns reflect Victorian-era prosperity, industrial capability, and the professionalization of engineering as a discipline. The consistency across regions results from knowledge transfer through professional networks, published journals, and international expositions. The anticipatory design reflects conservative engineering, building with safety margins and future expansion in mind. The administrative language of restoration and traditional standards is simply rhetorical flourish, invoking classical precedent to justify modern projects. This model accounts for most of the evidence through documented historical processes. The second model proposes knowledge inheritance from earlier civilizations. The infrastructure patterns reflect rediscovery and adaptation of engineering principles from Roman, Islamic, or other historical sources. The consistency results from multiple societies accessing the same ancient knowledge base, through archaeological discovery, preserved texts, or cultural continuity in regions that maintained older practices. The anticipatory design reflects application of proven historical methods rather than experimental innovation. The administrative language accurately describes what was happening: restoration of known effective practices that had been discontinued. This model accounts for the evidence through historical continuity and knowledge recovery. The third model suggests the patterns indicate coordinated implementation of a comprehensive system following a civilizational disruption. The infrastructure consistency reflects not independent development but systematic reconstruction based on surviving knowledge from a prior global civilization. The anticipatory design exists because the specifications weren't predictions of future needs but accommodations for system requirements that were already understood. The administrative language is literal. These were restorations, re-establishments of standards that had existed before. This model accounts for the evidence through civilizational discontinuity and knowledge preservation. Each model has explanatory strengths. Each faces evidentiary challenges. The conventional model struggles with the scale of consistency, the precision of specifications appearing simultaneously across disconnected regions, and the lack of documented coordination mechanisms. It also doesn't fully address why so much infrastructure was built with excess capacity that wouldn't be utilized for decades. The knowledge inheritance model faces questions about transmission mechanisms. If ancient engineering knowledge was being recovered, why does it appear so suddenly in the late 1800s rather than gradually through earlier centuries? Why do the specifications match across regions with different historical influences? The civilizational disruption model requires evidence of the prior civilization and the disruption event. The architectural and infrastructural patterns are consistent with this interpretation, but direct documentation of a global pre-1800s advanced civilization remains limited to reinterpreted existing structures rather than unambiguous historical records. The evidence invites examination from multiple perspectives. Return to 1816, the year without summer. Volcanic eruption of Mount Tambora caused global temperature drops, crop failures, and social disruption. The event is well documented. What's documented less thoroughly is the infrastructure response in subsequent decades. The 1820s through 1850s saw massive urban reconstruction across Europe and North America. Cities were rebuilt with new street layouts, new building codes, new infrastructure systems. This reconstruction coincided with what historical records describe as recovery from the Napoleonic Wars, industrialization, and urban modernization. The timing is notable. Within one generation after 1816, the infrastructure patterns we've examined began appearing. The anticipatory design, the excess capacity, the consistent specifications, the administrative language of restoration. Whether 1816 represents a marker point for broader disruption or simply coincides with industrial transformation depends on interpretive framework. The metaphor matters here. When we talk about Tartaria in contemporary alternative history, we're not necessarily talking about a specific empire with defined borders and documented rulers. We're talking about a conceptual framework for interpreting architectural and infrastructural patterns that seem incongruent with conventional historical timelines. Tartaria becomes shorthand for whatever system preceded this one. It's a placeholder term for pattern recognition that exceeds current explanatory models. The buildings remain regardless of interpretation. The specifications are measurable. The infrastructure functions. The administrative language exists in archived documents. What we call it matters less than what it represents. Evidence of systematic knowledge implementation on a global scale during a specific historical window, described by contemporary engineers and planners as restoration rather than innovation. The health measures in early 1900s civic buildings. The ventilation systems, the cubic air volume standards, the material selection for sanitation, the window ratios for natural light, the temperature regulation. These weren't experimental. They were implemented as known effective practices. They worked immediately because they were applications of established principles, whether those principles came from Victorian engineering innovation, recovered historical knowledge, or inherited civilizational understanding. The outcome was the same. Cities built in this period created passive health infrastructure that reduced disease transmission, improved air quality, and extended life expectancy, effects that were measurable before their mechanisms were scientifically understood. The architecture performed functions that its builders described as proper and traditional, even when those functions preceded their medical justification. That remains the central observation. Infrastructure was built ahead of need, according to consistent specifications, using anticipatory design principles, implemented as restoration of standards rather than development of innovations. The pattern exists. The interpretation remains open.